Dear colleagues, first of all, we would like to thank the EAVLD Conference Committee for giving us the opportunity to present results of our work on Salmonella di Arizona at this meeting. In the course of this presentation, I will use the term sheep-associated Salmonella di Arizona as a short form for Salmonella enterica subspecies di Arizonae serovar 61K157. So, what is the outline of this talk? Firstly, I would like to present a few important facts about this specific Salmonella di Arizona serovar. Then I will explain the aim of our study as well as the design and the main results. With a short outlook, I will finish this talk. So, what do we know about this specific Salmonella di Arizona serovar? Sheep-associated Salmonella di Arizona is considered to be sheep-associated. It has been detected in the intestine of sheep without clinical signs or pathological findings in several European countries such as Norway, Germany, Sweden, Switzerland, Spain, and as well as in the US. Moreover, it was isolated from ovine tonsils sampled at slaughterhouses in Norway and Switzerland. Interestingly, Swedish authority decided to exclude sheep-associated Salmonella di Arizona from regular control programs on Salmonella in sheep because of its high frequent detection in fecal samples. On the other hand, this Salmonella di Arizona serovar is described in the context of clinical disorders like abortion, enteritis, or orchitis in sheep. The first description in sheep was done by Riff et al. In 1952, which found this specific Salmonella di Arizona serovar in carcasses of aborted ovine fetus. Sheep-associated Salmonella di Arizona can sporadically infect humans, but the published reports are seldom. Recently, sheep-associated Salmonella di Arizona was isolated from urine of a patient with a urinary tract infection. Interestingly, in the context of zoonosis, it was also found in ground beef in US. Besides these facts, this sheep-associated Salmonella di Arizona is of special interest because it is the only Salmonella serovar described as the causative agent of chronic proliferative rhinitis (CPR) in sheep. To the best of our knowledge, CRP has been documented so far in US, Spain, and also in Switzerland. In our country, chronic proliferative rhinitis in sheep was first described in 2017 in a flock of Texel sheep. So far to the facts about sheep-associated Salmonella di Arizona. And now to our study. As I told you, up to now in Switzerland the finding of CPR caused by sheep-associated Salmonella di Arizona and also nasal colonization was restricted to a single Texel sheep farm here. Therefore, the aim of our study now was to determine the prevalence of sheep-associated Salmonella di Arizona in the whole Swiss sheep population using a representative sample. The results should then form a basis for further risk analysis. So, from May 2017 to June 2018, a total of 681 nasal swabs from clinical healthy sheep of 141 different farms throughout Switzerland were taken. The number of farms was calculated proportionally to their ovine population size. Depending on the size of the flock, up to 5 samples were taken by chance. Swabs were then analyzed by normal selective enrichment for the presence of Salmonella species. And now to our results. The prevalence on animal level was moderate with 21%. meaning 146 single swab samples were positive for sheep-associated Salmonella D. arizona. But when we look at the herd level, it turned out that nearly every second tested herd was positive for this serovar. We have finally found a prevalence on herd level from 52%. The number of animals being positive reached from 1 to 4 animals per herd. The table listed the prevalence for the different cantons, but this data has to be interpreted with caution, as the overall number of farms tested is low and therefore confidence intervals are wide. Nevertheless, the number of tested farms were above 10, where the number of tested farms were above 10, the prevalence on herd level is high and ranges broadly from 43 to 80%. In contrast, in the canton of Valais, the prevalence seems to be very low, with just 50%. These figures just illustrate the positive and negative tested herds all over Switzerland. What other results were we able to achieve? We could show, and this was very important for us, that several breeds, not only Texel sheep, which are rather rare in Switzerland, were affected. And adult sheep, meaning sheep above 1 year, were significantly more positive than younger sheep and lambs. What do these results tell us about the role of this specific Salmonella D. arizona serovar in sheep and how to proceed? First of all, in other studies it was shown that sheep-associated Salmonella D. arizona is a long-term colonizer in the intestinal tract and in tonsils of sheep. Our results indicate that sheep-associated Salmonella D. arizona is also a long-term colonizer in nasal cavities of adults. To be aware, we have sampled healthy sheep in our study. So colonized sheep could serve as a reservoir. And with these findings, we confirm the postulate of Brogdon et al. Published already in 1994. Moreover, as the overall herd prevalence in Swiss sheep is high, the pathogenic impact of sheep-associated Salmonella D. arizona on the health status of sheep has to be clarified. Further research should now focus on one hand on comprehensive studies about the respiratory health status of Swiss sheep. Is there a problem of so far underdiagnosed clinical disorders? We have seen a very high prevalence on herd level. On the other hand, basic research has to be continued to identify possible factors that induce and enable sheep-associated Salmonella D. arizona to cross the epithelial barrier, leading to severe inflammation and clinical disorders. Up to now, molecular-based studies published recently couldn't address such factors. So it remains exciting, and hopefully one can elucidate pathogenesis of this special and very interesting sheep-associated Salmonella D. arizona serovar in the future. And with this, I finish this presentation. Thank you for your attention and be happy to answer your questions.